Hi, I'm Claire and I'm a pelvic health physiotherapist. And what that means is I'm a physiotherapist that helps women and men of any age with regards to their pelvis. Now, more specifically, this can relate to bladder symptoms, bowel symptoms, symptoms relating to intercourse, for example, painful intercourse. And I'm really passionate about supporting women through menopause as they navigate a lot of the changes that can start to happen with regards to bladder symptoms or constipation or intercourse. And I love being able to support them as they want to maybe be more active, but sometimes pelvic health and pelvic floor symptoms can become a barrier. So it's really important that we understand our pelvic health in context of menopause and the things that we can do to help ourselves navigate this time of life. So the pelvic floor muscles sit at the base of the pelvis. So this is a female pelvis and the pelvic floor are these muscles here. So they come from the coccyx here at the base of your spine. So your spine comes up here, you have the sacrum and then the coccyx, which is the little bones at the bottom, and the pelvic floor attaches onto there. They attach onto the sitting bones and onto the pubic bone at the front as well. And these muscles are actually made up, well, there's lots of little muscles that make up the pelvic floor. And the pelvic floor itself also includes the sphincters that wrap around your urethra, which is the tube that brings urine out of your bladder, as well as the sphincters that wrap around your anus. And together, these work together for 5 key roles. First of all, they help to keep us continent of urine, feces and wind, so really important. They are also part of the network that helps support our pelvic organs. So our pelvic organs for women are your bladder, your womb and your bowel. So the pelvic floor muscles, along with the fascia and the ligaments above, help to support these organs. Now also they help to contribute to our sexual pleasure. So the pelvic floor muscles have a rhythmic contraction at orgasm. And also they help to work with other muscles around the core to support our spine as well. These also help to pump blood and lymph fluid around the pelvic region, and this can be really important at menopause. The tissues are a lot drier, and actually contracting and moving our pelvic floor muscles help to improve blood flow to the area, which is really, really important for tissue health. Thinking about our pelvic health through menopause is really important as we can start to experience certain symptoms that can really impact our day-to-day life. Most commonly, these are related to our bladder, our bowel and intercourse, and these are hugely down to the changes in estrogen level. But it's not necessarily all to do with hormones, but let's just start there. So as estrogen declines, this starts to have an impact on lots of tissues in the body. But the vaginal and vulval tissues have a lot of estrogen receptors, and therefore this area can be impacted quite greatly by this, and we notice a lot of changes to these tissues. This can make us more susceptible to things like urine infections and make us more urgent or need to go more frequently to the toilet, including overnight. It can also, because the tissues are thinner, make intercourse more painful as well. And all of these things can start to impact how our pelvic floor muscles behave, but also we may have entered menopause with our pelvic floor muscles not being that strong. Maybe we've had children and childbirth and pregnancy has weakened these muscles and we've not maybe known how to rehabilitate them or what to do in order to support those muscles. But also we need to be understanding of the fact that actually through menopause we are aging, and we know that after our mid-30s, muscles are sort of on the decline is the best way to think about it. And there is a process called sarcopenia that as we age, our muscles change and they weaken, and therefore we have to work hard in order to look after these muscles and make them stronger. So most commonly the symptoms that occur through menopause can be hormone related, but also due to the changes that are occurring in the muscles. We may also start to become more constipated and struggle with our bowels more, which may lead to us straining more. And then again, this can have an impact on weakening the tissues and also play into other symptoms that we experience. So it's really important to understand the overview of our pelvic health and not just view it's like, well, there's nothing I can do, I'm just getting older. There's absolutely things that we can do and we should be doing in order to help us as we navigate this time of life. The most common symptoms that I support women with through menopause are urinary incontinence, but also fecal incontinence or wind incontinence. So really any control of your bladder and bowels that may have felt different. And this may not be actually new to menopause. This may be something that's been grumbling away and you've had some experience of, but maybe has got worse through this time of life. I also support a lot of women who experience pelvic organ prolapse. And again, this may not be new in menopause, but sometimes symptoms can be more prevalent or worsen because of the hormonal changes that are going on and the fact that the tissues are now different as well. I also support women that feel like their incontinence or prolapse limits their ability to exercise, because it's really important that we consider pelvic health alongside our bone health and our wider muscle health, not just our pelvic floor muscles. We know that lifting weights or doing impact training is really important for bone density. However, pelvic health can be a big barrier to doing those things. So my role is to try and support you to be more active and help you understand what things you can do to make sure you're able to do those things. Bowel symptoms can be really tricky, as we've mentioned. Constipation can be quite common as well. But pain with intercourse and feeling like maybe that's it, my sex life is over, it's absolutely not. And working closely with your doctors, we can also help you as physios to improve pelvic floor muscle function, whether it be related to the fact that things don't feel as pleasurable, or maybe it's not possible and it's painful and we actually need to help your tissues be able to tolerate intercourse, and maybe things like smear tests as well. So it's a broad range of symptoms, and what I would say is, though these symptoms can be really tricky to talk about, as physios we are so ready to talk to you about them, and there is no shame and there's nothing wrong with you bringing these things to discuss them with us. We're ready to talk about them and we want to help you. I often get asked this question, is whether menopause causes incontinence. And the way I view the body is it's never quite that simple. Though menopause might be a time in life when we start to experience more incontinence, it doesn't mean that actually menopause is fully responsible. As we've mentioned in some of the other videos, there are lots of things that contribute into how our pelvic floor work and how pelvic floor functions, and also our bladder function. So though we might start to experience more symptoms, this can be related to the estrogen changes that mean there are changes to the vaginal and vulval tissues as well. There's also the aging process of our pelvic floor weakening. All these things together can start to mean that we experience more incontinence. And yes, of course, the changes that are occurring in menopause will be playing into this. And the topic of genitourinary syndrome of the menopause being that we can start to experience more bladder symptoms due to the changes in estrogen levels. It doesn't mean it's all to blame. And I often encourage you to look back on life and think, well, you know what, we've had pregnancies, potentially we've had children, we've had how you've given birth, and all of these things can play into why we experience symptoms. And we might have got away with things because we've had these higher hormone levels, but it's not just that decline in estrogen that's causing all of the symptoms. There's other things at play as well. We need to think about your bowels as well as part of this picture. So yes, we need to think about those hormones, and we absolutely should be working with our doctors. Maybe it would be really appropriate to have some vaginal estrogen. But it's not the whole story. So it's, again, no one thing is probably the solution. We need to do pelvic floor muscle exercises. We need to not just focus on strength. We need to have a good flexible muscles as well. We know from research that pelvic floor muscle exercises help with elasticity in the tissues, blood flow to the tissues, strength of the tissues. So that is really important as well, but it's unlikely to also be the whole part of the picture. So it's bringing everything together to help you if you're experiencing these symptoms, and also think about when are you experiencing incontinence and other things around how you're exercising that we might also need to help you with some strategies to help with that as well. Pelvic organ prolapse is where one or more of the vaginal walls fall down into the vagina. So at the front of the vagina, you have the anterior wall, which is by your bladder. You then have the posterior wall, which is by your bowel and your rectum. And then above, you've got the cervix. Now, any of these walls over time and for a variety of reasons can become more stretched and then they can drop down into the vagina. The most common symptoms that women will often report is the sensation of something being in their vagina that shouldn't be there, a heaviness or dragging sensation that they might get at different parts of the day or different times of the month, or at different activities as well. They may have this feeling of a tampon not being in quite the right place and being slightly lower. There may also be associated bladder and bowel symptoms, but you can have a prolapse and not have bladder or bowel symptoms as well. They may also visibly have a look at the vaginal opening and see something there that they haven't seen before. If you're seeing this or experiencing any of these symptoms, assessment is needed. And I'd recommend that you either see your doctor, a general practitioner, or try and see a specialist pelvic health physiotherapist. We will then do an assessment to help you understand what is going on and what the best treatments are for you going forwards. Often if we're diagnosed with a prolapse as we go through perimenopause or menopause, menopause itself, when those hormonal changes, can get all the blame for the prolapse occurring. But actually sometimes it's that throughout life prior to perimenopause, there's already been some changes to the vaginal walls. What's happening during the perimenopause and menopausal time is that we are becoming more aware of it because of the hormonal changes going on in our body and the impact that this has on our vulval and vaginal tissues. So as we've already explored, as the estrogen levels drop, this has an impact on all of our body. But because the vagina and vulval tissues have a higher number of estrogen receptors, these tissues can be more impacted. When the tissues of the vulva and vagina are drier and thinner, we can have more awareness of changes in the vagina as well. So we may become more symptomatic of a prolapse, even if maybe we weren't aware it was there before. Now, yes, as we age and we have muscle changes as well, and maybe we're not keeping our pelvic floor strong and our tissues are going through these changes due to hormone changes, we can be more at risk, especially if we're also starting to struggle with constipation during this time and maybe we're straining. So it's really important we know how to support ourselves, to do some preventative work, but also what can we do if we start to experience these prolapse symptoms. A prolapse is diagnosed when a doctor or a physiotherapist does an extensive examination to have a look at the vaginal walls. This may or may not include the use of a speculum. We're looking for the position of the vaginal walls, the movement of these walls during certain tasks, and we will talk you through that at the time. We also want to correlate this with your symptoms, because generally speaking, a prolapse is diagnosed when you are symptomatic. It can be quite a confusing thing, pelvic organ prolapse, because sometimes women will have changes to their vaginal walls, but actually not have any symptoms. And there is some research that shows that 50% of women who haven't had children will have some degree of changes to their vaginal walls as they go through life. So sometimes the change to the vaginal wall, maybe it being slightly different and sitting in a slightly different position, isn't necessarily of concern. Our most important thing is to think about you and any symptoms that you have and make sure that you're comfortable and it's not interfering with your day-to-day life. First-line treatment for mild to moderate pelvic organ prolapse is support from a pelvic health physio like myself. We will assess and support you with your pelvic floor muscle exercises to build up the strength of the muscles underneath the vaginal walls and the pelvic organs to provide as much strength as possible. This can help your symptoms and help you to feel a lot better day to day. However, we'll also look at your bladder and bowel habits to make sure that these are not contributing to your symptoms or potentially worsening your symptoms going forwards. We'll also discuss intercourse and make sure you feel comfortable and you understand how intercourse and prolapse can relate, and to make sure you feel really confident in your body as well. There are also adjunctive things like pessaries, and there are two main types of pessaries that we generally use, a cube pessary or a ring pessary. Now these can be fitted by a doctor or a specialist physio who has the training to do so. And these basically sit inside the vagina to support the vaginal walls. We sometimes describe them like a sports bra. As we age, we sometimes associate our breast tissues having been stretched and sitting slightly lower and needing a good sports bra to provide some support. If we think about that in relation to your vagina, when these walls are stretched and they sit slightly lower, sometimes a pessary can come in and provide lovely support to help your symptoms. And for some women, they might need that during all day, and they might wear a ring pessary, for example, can be worn for a number of months. For others, they might feel they just need it at some points of the day, or at some points of the week, or month, or during certain activities. And then we can teach you how to fit your own pessary and use that for the times that you need it. So it doesn't have to be one thing or the other. We can get your pelvic floor stronger. We can use a pessary as well. We can think about your bladder and your bowel, and we can think about supporting you to do the exercise that you may love to do, which can feel quite scary if you have a prolapse. So that's how the treatment generally starts. Now, if what we call conservative treatment, which is what we do as physiotherapists, doesn't work, we may then refer you on to speak to a surgeon about surgery. But what I'd encourage you is, having a prolapse does not mean you absolutely have to have surgery. But for some women, it is the right decision. But again, it doesn't have to be either or. It can work together, and often the more we work together to support you, the better your results and your quality of life. Pain during intercourse is incredibly common during menopause, and this is predominantly down to the changes that occur in the vulval and vaginal tissues due to the lowering of levels of estrogen. The impact this has is the thinning and drying of the vulval and vaginal tissues, which then can understandably make intercourse more uncomfortable, but can also lead to sort of splitting of the tissues, a bit like little paper cuts, and these can be incredibly sore. What can then happen if you start to experience pain with intercourse is your pelvic floor muscles respond because they want to prevent this, they want to try and stop it hurting you. But unfortunately, the process of them tightening, which is something we call vaginismus, can also lead to more pain. Now there is hope. I promise you, it doesn't just have to be like this. We can help the vaginal and vulval tissues in a lot of different ways. We can use a vaginal moisturiser or a vulval oil. Or if you speak to your doctor, you can also get something called vaginal estrogen, which is an estrogen cream or tablet that is used just in the vagina or on the vulval tissues to help replenish some of the estrogen that you don't have. And this can make a huge impact to those tissues and make intercourse a lot more comfortable. Some women may develop other skin conditions, and something called lichen sclerosis or lichen planus can be something that you may occur at any point in life, but sometimes during menopause as well. And seeing a vulval dermatologist can help you to understand any of the skin troubles to help make sure your treatment is correct. If you feel like you've noticed your muscles are tightening or you can see that you're getting very tense, we can then as physiotherapists can actually support you in retraining the muscles' response if you've had quite a while of experiencing pain. So when we're thinking about helping you to have pleasurable intercourse and it not be painful, we need to think about the tissues and we need to help them as well. And generally we need to do that first. And then alongside that, we can help your muscles to respond correctly. And we may recommend the use of something we call vaginal dilators. Now, these are not actually aiming to stretch your vagina, but actually helping your muscles to retrain to when penetration occurs. And this may not only be in intercourse, but say during a smear test or other things and examinations like that. We can help the muscles to respond correctly and not to tighten at time of penetration. This can then make everything much more comfortable and pleasurable for you. We understand that talking about intercourse can feel embarrassing, but as healthcare professionals, we're incredibly used to talking about it, and we really want to make sure that you feel able to come and talk to us about it. So maybe jot down any concerns you have if you're feeling a bit worried about talking about it, and take them to your doctor or to a physio, and then we can help support you with the best way forwards. My 5 top tips for anyone going through perimenopause or if you're postmenopausal is first of all, prevent constipation. We are much more likely to experience constipation during this time of our lives, and making sure we're thinking about fibre, fluid and movement can really help our gut. But if that's not working for you, please don't be embarrassed to speak to a doctor. You may need a gentle laxative to help you, or there may be other nutritional things that can be done. But preventing constipation and straining down onto our pelvic floor and our vaginal tissues is really important at this time of our life. Secondly, I encourage you all to do pelvic floor muscle exercises. We don't just need to do these when we have symptoms, we actually want to keep the muscles strong to prevent symptoms. In the same way we might want to exercise the rest of our bodies to stay strong and feeling good, our pelvic floor muscles need to be included in this. Third of all, as I've started to mention, thinking about keeping active and moving. This can be what you enjoy, it doesn't have to be a specific workout program. Walking, or maybe doing some gentle home workouts, or Pilates, or yoga, or finding an exercise class with one of your friends. Keeping active is so good for all of our pelvic health, whether that be the muscles themselves or our gut or our mental health as well. So please do think about how you can bring little bits of movement into your day. It doesn't have to be a complete lifestyle change. We can start to bring small things in incrementally, which make a big difference. Number 4, think about how you can take care of those vulval and vaginal tissues through the changes that they're going through. Maybe explore using a vaginal moisturiser or a vulval oil, or speaking to your GP about the use of a vaginal estrogen. And finally, I really recommend that you don't suffer in silence if you're experiencing any of the symptoms that we have explored. And getting some personalised support from a pelvic health physio can be absolutely life-changing. It doesn't mean you have to come for tons and tons of sessions, but it might be helpful for you to understand how you can optimize things for yourself so you feel strong and empowered through this time of your life. So let's go through together how to do pelvic floor exercises so you can get going on these at home. So let's familiarise ourselves again. So this is the female pelvis and this is the pelvic floor. So the pelvic floor muscles come from the coccyx forwards to your pubic bone and to your sitting bones. And a lot of the muscles are around your anus. So what I encourage you to do now, whether you're sitting or lying, is to think about gently squeezing around your anus, around here, but not using your bottom cheeks. Okay, so you shouldn't be moving up and down. You shouldn't see an external movement. You should just feel inside of you a gentle squeeze around the muscles and then think, can I squeeze it and can I fully relax it? I then want you to visualize, if you're feeling confident with that, I want you to think about your anus coming forwards through the vagina towards your pubic bone. So for example, if you're sitting, you're thinking about this movement coming upwards and forwards towards your pubic bone and then fully relaxing. So what you should feel is this tightening internally, but without your tummy, your legs, or your bottom kicking in. Now, what often is the case is this is a more subtle contraction than we're expecting. We're expecting to feel something really, really big and we want to give it 1000%. But sometimes trying a little less hard and doing a little bit more of a gentle contraction can actually help us to connect with these muscles better. Once we know how to contract and also fully relax, the relaxation is as important. And sometimes we need to visualize that occurring. So what I get you to visualize is think about your vagina. If it's already squeezed, fully relaxing and dropping down. So try that just a few times to feel comfortable and confident with what you're doing. Then we want to do two different types. We call them short and long. So the short ones are just how you contracted. So you're thinking about your anus coming forwards to your pubic bone and then you're fully relaxing. And you're just going to repeat that on and then off 10 times. Okay, so just in a row 10 times. There's no rush, you just want to go on and off. I describe it a bit like a light switch. You're on and you're off. Okay, and get really familiar with doing that. Once you're confident at doing that, we want to progress to being able to hold the contraction whilst we breathe before we then fully relax. So try this now, and this might feel really difficult if you've never done these before, and that's okay. We can work with what we've got and build up. It's the same contraction again. You're thinking about bringing your anus forwards to your pubic bone and you're now going to hold it there for 10 seconds whilst you breathe in and out. So let's go for it. 2 and 3, keep holding. 4 and 5, keep holding. 6 and 7, keep going. 8 and 9, and then relax. So what I was able to do there is hold for 10 seconds. I'm breathing, I'm talking, and then I relaxed. Now I've taken a long time to practice that, so don't panic if you can't. What I encourage women to do is think about holding maybe for just 3 seconds and seeing if you can hold it for that long and then let go. Build up to 5, 7, and then 10 seconds. Getting that breath control can be really, really hard. They don't need to be deep breaths. You just need to make sure you are breathing and not holding your breath at the same time as holding your pelvic floor. Now, ideally over time, what I'd encourage you to work up to is 10 of those short ones and 10 of those long 10-second holds once a day as to start with. Now, if you've got symptoms of bladder incontinence or bowel incontinence or bowel urgency or prolapse, we may want to increase that to 2 to 3 times a day. However, I highly recommend that if you are experiencing these symptoms that you do get tailored, personalised advice. So these exercises are something to get started on. And for those of you who are thinking, actually, I don't have any symptoms, but I just want to be really proactive in taking care of my pelvic floor, these are things that you can work on, as I say, daily. Start with once a day. And if you want to and you feel more confident, you can always do more. I do also work with women to think about the positions that we're doing it in. So lying on your side will be easiest initially. You can also try lying on your back or sitting. And over time, we want to progress to doing it in standing. Because like most exercises, when we're standing up, they're a lot harder. And when it comes to the pelvic floor, there's more gravity involved and more pull. And so it can make it harder for the muscles to contract. So I hope that helps you to get started. But as I say, any personalised advice, or if you feel, you know what, I cannot feel these muscles working and I don't know how to connect with them, that's where a pelvic health physio can help you learn more about your body and how to connect with these muscles and make a tailored plan to help you going forwards.